Have you ever wondered if your body is quietly trying to tell you something important? Cancer is a disease that often starts silently, with symptoms so subtle that they're easy to overlook or dismiss. Yet paying attention to these early signs can make all the difference. Early detection isn't just about catching the disease. It's about improving your chances of beating it. In this guide, we'll uncover 10 surprising early signs that might indicate cancer and explain why they shouldn't be ignored. 1. Persistent fatigue, not your everyday tiredness. We all feel tired from time to time, but persistent fatigue is a whole different story. Imagine waking up after a full night's sleep and still feeling drained. This unrelenting exhaustion, even when you're not overworked, could be an early warning sign of cancer. Cancers like leukemia or lymphoma affect your blood and bone marrow, disrupting your body's ability to produce healthy red blood cells. This lack of healthy cells means your body doesn't get the oxygen it needs, leaving you feeling chronically tired. Similarly, cancers like colon or stomach cancer can cause internal bleeding, leading to anemia and persistent fatigue. Fatigue caused by cancer doesn't just make you sleepy, it affects your entire body. You might notice muscle weakness, mental fog, or even difficulty concentrating. If this kind of fatigue lingers for weeks and doesn't improve with rest, it's time to consult a doctor. 2. Persistent headaches that won't quit. Headaches are common, but a headache that sticks around for weeks and resists treatment isn't something to ignore. A persistent headache could be an early sign of a brain tumor, especially if it's accompanied by other symptoms like blurred or double vision, changes in hearing or balance, seizures or confusion. Unlike regular headaches, cancer-related headaches are often persistent and can worsen over time. They might feel different, sharper, more localized, or accompanied by nausea. If you've been popping painkillers with no relief, it's time to get checked. 3. Changes in bathroom habits. Our bathroom habits are a window into our health, and unexpected changes could signal something serious. Whether it's chronic constipation, frequent diarrhea, or changes in stool color, these symptoms can indicate underlying digestive issues. Colon cancer, persistent diarrhea, or narrow stools could be early warning signs. Bladder cancer, pain during urination, increased frequency, or blood in the urine might point to a problem. While not every change means cancer, any new or persistent issue with your bowel or urinary habits warrants a conversation with your doctor. Or unexplained pain. When your body cries for help. Pain is your body's natural alarm system, and when it becomes persistent and unexplained, it's a sign to investigate. For instance, abdominal pain could indicate cancers like pancreatic or liver cancer. Breast pain that doesn't go away might be an early sign of breast cancer. Men experiencing scrotal discomfort or swelling should consider the possibility of testicular cancer. Ignoring pain can be tempting, but don't wait for it to go away on its own, especially if it persists for weeks. Hive sores that just won't heal. A mouth sore that lingers longer than 2 weeks or keeps coming back isn't normal. Persistent sores, especially those with white patches, could indicate oral cancer. If you smoke or drink heavily, your risk increases significantly. Pay attention to difficulty swallowing, painless lumps inside the mouth or on the gums, white or red patches that don't fade. Early detection of oral cancer can save lives, so don't dismiss these signs as minor irritations. 6. Blood in stool or urine. Seeing blood where it doesn't belong is always a cause for concern. Blood in the stool might appear bright red or dark black, signaling issues like colon or rectal cancer. Blood in urine can range from light pink to deep red, often pointing to bladder cancer or kidney cancer. While these symptoms can also result from less severe conditions like hemorrhoids or urinary tract infections, they shouldn't be ignored. Persistent bleeding should always prompt a medical evaluation. 7. A nagging cough or persistent hoarseness. A cough that refuses to go away could be an early sign of lung cancer, especially if it's dry, hacking, or brings up blood. Similarly, changes in your voice, like persistent hoarseness, might point to throat cancer or thyroid cancer. These symptoms can often be brushed off as colds or seasonal allergies, but if they last for more than 2 weeks, it's time to see a doctor. Of course, unexplained weight loss, a hidden clue. Suddenly shedding pounds without trying might sound like a dream, but it can be a warning sign of cancer. Lung or pancreatic cancer. These cancers often lead to rapid weight loss due to metabolic changes. Stomach or esophageal cancer. Eating becomes uncomfortable, leading to unintentional weight loss. If you've lost more than 10 pounds in a short time without diet or exercise changes, consult a healthcare provider. 9. Excessive bruising or bleeding. Unexplained bruising, especially in unusual places like your back or abdomen, can indicate blood cancers like leukemia. These cancers affect your body's ability to clot properly, leading to easy bruising and frequent nosebleeds. Keep an eye out for bleeding gums, small red spots under the skin, petechiae, bruises that seem to appear without cause. These signs shouldn't be dismissed as clumsiness. They could be your body's way of signaling a deeper issue. 10. Persistent itching, a surprising symptom. Itching might not seem like a serious problem, but persistent or unexplained itching can be linked to liver cancer or lymphoma. These cancers can cause waste products to build up in your blood, irritating your skin. If the itching is severe and doesn't respond to moisturizers or antihistamines, it's worth getting checked. When to act. Listening to your body is the first step to staying ahead of serious health problems. If you experience any of these signs, don't panic, but don't ignore them either. Early intervention can make all the difference. 11. Night sweats. When perspiration speaks volumes. Occasional night sweats can happen to anyone, especially if you've had a fever or the room is too warm. But if you find yourself waking up drenched in sweat night after night without any clear reason, it could be a sign of something more serious. Lymphoma, a cancer affecting the lymphatic system, is one of the most common causes of unexplained night sweats. Night sweats can also occur in leukemia, as this blood cancer triggers your body's immune response, causing fevers and excessive sweating. While menopause and infections can also cause night sweats, persistent episodes that aren't tied to hormonal changes or illnesses should be evaluated by a doctor. 12. Persistent indigestion or trouble swallowing. We all experience indigestion from time to time, especially after a big meal. But chronic indigestion, bloating, or difficulty swallowing can indicate more serious issues like esophageal, stomach, or throat cancer. If swallowing feels uncomfortable or painful, it might be due to a tumor narrowing your esophagus. Frequent acid reflux or heartburn could also damage your esophageal lining over time, increasing the risk of cancer. If you rely on antacids or dietary adjustments but still face persistent symptoms, it's crucial to seek medical attention. Early detection can make a significant difference in treating digestive cancers. 13. Skin changes that go beyond the surface. Your skin is one of the most visible indicators of your overall health. Keep an eye out for moles or spots that change in size, shape, or color. Persistent redness, itching, or flaking in specific areas. Sores that won't heal, especially if they bleed or crust over. These changes could indicate skin cancer like melanoma or squamous cell carcinoma. For instance, melanoma often appears as a dark, irregularly shaped mole that grows over time. Proactive steps. Use sunscreen regularly to protect your skin from UV damage.